Hi everyone, Dr. Daniel Shanahan here from Legs, Foot, and Ankle Associates. Thanks for checking out our latest YouTube video. As always, make sure you receive our latest content. Subscribe by clicking the button below. Hit that button to receive notifications. And if you have a question you'd like answered, please feel free to leave us a comment. We'll get back to you. This video covers the topic of the top 5 shoe myths. We see a lot of patients waste a lot of money and time buying inappropriate shoes for their feet because of what they think they know about shoes or what they've been told by others. I often equate shoes to being like your tires. Just like a car has a wheel that needs a good tire on it, your foot deserves to have a good tire on it to function properly. So let's dive in. Number 5 on the list of the top 5 shoe myths. The lighter the shoe, the better. While a shoe that feels light doesn't feel heavy and bulky, may seem to be good for your feet, this is often not the case. Usually, shoes that are light in weight are also very light when it comes to the mechanical control and support that they can offer. So be careful when evaluating shoes and how light they are. For simple basic activity, they may feel fine, but don't count on them to provide protection and support if you are engaging in more intense walking or running types of activities. Number 4, it's a good shoe because a salesman said it has a lot of support. This is where, unfortunately, a lot of patients end up very frustrated with their shoe choice. They are told by a salesperson that has minimal training in the biomechanics of the feet and very little knowledge of how a particular shoe will work with someone's foot, that the shoe has a lot of support. I compare this to the idea of buying tires from someone who is simply selling a collection of tires but has no idea what kind of car you drive or what the demands are on that car. Let us assess your feet anatomically and biomechanically, and we will guide you toward the type of shoes you should be purchasing. Number 3, I've had them for several years, but they don't look worn out. Although your 3 or 4-year-old pair of shoes may still have some tread and don't have any holes in the sides, this doesn't mean they aren't worn out. With regular daily use, most shoes break down within 12 to 18 months with the efficiency of their support and control. Also, if you haven't cleaned the insides of the shoes on a regular basis, it's pretty scary to think what might be living inside of those shoes that are that old. Number 2, it has a lot of cushion, so it must be good for my feet. This is definitely a big troublemaker for many people and their feet. Just because the shoe has a big, thick, foamy sole and cushion, a lot of cushion built into it, doesn't mean it's good for your feet. It may feel good initially with all that cushion. However, that type of shoe typically offers very little stability and control and often leads to many different foot problems, especially if you are doing any sort of athletic activities with them. And number 1 on our list of top 5 shoe myths. I spent a lot of money on the shoe, so it must be good. There's no doubt that this is the number 1 myth of all. Just because you spent several $100s on a name brand shoe that has a celebrity's name tied to it does not mean it's an appropriate shoe for your feet. In fact, some of the worst shoes out there have absolutely stupid prices attached to them. If you want to learn about the right shoes for your feet, call our office, schedule an appointment for an evaluation. After thorough exam and biomechanical assessment by Dr. Petronella or myself, we can guide you to the best shoe gear for your feet to help prevent painful problems. Not every tire is right for every car, and not every shoe is right for your foot. Thanks again for watching, and please remember to subscribe below and hit that like button or leave us a comment. We'll look forward to seeing you next time. Have a great day. Dr. Daniel Shanahan, Legs, Foot, and Ankle Associates.